dear friends and associates from Asian Pacific Society of Cardiology, I would like to express my thankfulness for your warm welcome to join this Asian Pacific Leadership Series with respect to current issues and future prospects of our own society. My name is Charles Jia-Yin Hou. I'm president of Taiwan Society of Cardiology. Today, my sharing will be focused on two aspects. One is Taiwan Society of Cardiology current status. The second will be there are several new frontiers to be explored. So this requires crosstalks between society other than cardiology society. Third topic, I would like to talk about our next generation cardiology training. And fourth will be unmet needs, not only from Taiwan Society of Cardiology, but also from Asia Pacific region as well. With respect to Taiwan Society of Cardiology current status, these are the history. We established our society back in 1960, and at the same year, we joined Asia Pacific Society of Cardiology in Manila. So we are one of the founding members of APSC. And 1978, we joined World Heart Federation during World Congress of Cardiology held in Tokyo. And 2008, we became affiliate society to European Society of Cardiology, and we become Taiwan chapter to American Cardiology back in 2014. From the domestic perspective, we have tight collaboration with Taiwan Heart Foundation, which is an institute focusing on public education, patient education, and advocacy. Currently, TSOC has altogether members of more than 1,800. Among them are more than 1,300 are adult cardiologists, more than 500 instructors, more than 200 pediatric cardiologists, and 67 as instructors, and 249 cardiovascular surgeons, 76 as instructors. We have major collaboration with brotherhood or sisterhood societies like Taiwan Hypertension Society, Society of Cardiovascular Intervention, Heart Rhythm Society, Association of Thoracic and Cardiovascular Surgery, Society of Pediatric Cardiology, Society of Echocardiography, and Pulmonary Hypertension Association, and Society of Heart Failure, and Society of Lipids and Atherosclerosis. These societies actually founded after TSOC, and because of a need for subspecialties. So most of the members they decide to have this subspecialty societies. Actually, some of the society we have joint board exam as well. These are milestones of Taiwan Society of Cardiology. We have first coronary angiography back in 1958, first PDCA in the 1980, first stand barometer stent in 1995, and so forth. We have first PTMV back in 1986 and TAVI 2010. Nuclear medicine started in Taiwan back in 93, and cardiac CT in 1994. Cardiac MR 1980, and echo. We have the MIBO and MO. I believe most of our members at the Asian Pacific Society of Cardiology, probably especially young generation, does not know what MIBO and MO is. This will kick off in back in 1990s, and 2D in 1970s, and color Doppler and transesophageal echo in 1980s. IVUS in 1990s, and electrophysiology. Actually, electrophysiology initiated earlier than 1978, but during that time, we are talking about invasive electrophysiology. And we have the first catheter ablation back in 1980 and ICD implant in 1995. With respect to cardiac surgery, we have first cardiac implant in 1987, first total artificial heart implant, the Phoenix 7 in 1996, and BAD 1996. Pediatric transplant was kicked off in 2000, 1991, we implant this heart in a 2.5-year, 10-kilogram baby, which is successful. And then 1997, we have a full ECMO program. So far, the longest ECMO cases stay on ECMO for more than 6 months. And pediatric cardiac intervention back in 1984, and pediatric ablation in 1991, and pediatric ICD in 2005. This is the Society official journal. Most of our scientific publication will publish on Acta Cardiologica Sinica, which is a SCI Index official journal. As you can see, there are several different types of front page that go through along the history streamline. The left-hand side is the latest one, our front cover page. Now let's talk about what are the frontiers we shall look more deep into and remain to be explored on top of mainstream training or discipline like hypertension, heart failure, EP, arrhythmia, surgery, and PCI, and so forth. Of course, the major problem is that we ran into the global COVID-19 pandemic, which kicked off at the end of 2020. But then again, due to technology advancement, most of our symposium or discussion meetings can be held through webinars or online meetings. These give you a brief picture of how impact of COVID-19 pandemic in Taiwan, especially during the mid 2021, where we have a major community outbreak in May. But then again, you can see the graph, the case number dropped sharply after several months. So far, I think we're doing a good job. I'm looking forward to a new discipline in Taiwan, which is cardiac oncology. Now, since oncology patients, these cancer patients have facing their new treatment modalities in the past 10 or 20 years, like target therapy or immunotherapy as well. Of course, these new treatment modalities lengthen their life or longevity, but on the other hand, created some problems as well. For example, immune stone can create heart failure, especially among high-risk patients. These patients, most of them, once they have cancer, they often have multiple comorbidities as well. Like they have high blood pressure, they have diabetes, they have coronary artery disease, and so forth. So how shall we collaborate with oncologists and based on a total or holistic care point of view to care these multidiscipline and complicated patients? We try to focus on cardiac oncology, this new discipline in Taiwan Society of Cardiology. And so we formed a task force back in 2021. We have multiple crosstalks with, as you can see, different oncology societies like Taiwan Oncology of Society, Clinical Oncology Society, and Society for Therapeutic Radiology and Oncology, and Lung Cancer Societies, just to name a few. Through multiple webinars, online meetings, expert consensus, and finally, we published a joint statement, an overview of cardiac oncology, a new frontier to be explored, which published in our official journal, Acta Cardiologica Sinica, in an attempt to raise physician awareness, not only from oncologists, but also from cardiologists, for individual hospitals to expect to send people to get trained in the field of cardiac oncology, so that more and more cardiologists, oncologists in the future can work hand in hand together to deal with these complicated patients with cancer and cardiovascular disease at the same time. We also put more attention on rare disorders or dysfunctions like Fabry disease and amyloidosis. We have joint sessions with experts in Fabry disease, pediatrics, adult cardiologists, and so forth, electrophysiologists, and so forth. And through multiple webinars, online meetings, joint sessions, especially with collaboration with Society of Nuclear Medicine of the Republic of China, we propose an advocacy statement for the role of TCPYP scintigraphy in the diagnosis and treatment of transthyretin cardiac amyloidosis, ATTR, which also published in Acta Cardiological Sinica, our official journal, to raise physicians' concern that if there's a phenotype suspicion of patient may have ATTM, TCPYP may play an important role for imaging acquisition and help facilitate further diagnosis of ATTR-CM and subsequent treatment to kick off earlier. And another one would be TSOC expert consensus on clinical feature diagnosis and management of cardiac manifestation of Fabry disease, the rare disorder. These are extremely focused, well-prepared, prospective expert reaching consensus, nice paper. We also have crosstalks with different disciplines, diabetologists and nephrologists through webinars, joint sessions as well. Actually, only in the year of 2021, we have more than 10 joint sessions with nephrologists and diabetologists. We expect to go on in the year 2021 and 2022 as well. Another one would be gender-specific cardiology or women cardiology, to be precise. Women occupy almost half of our population, but from the cardiovascular disease spectrum perspective, women behave much difference in the field of cardiology. For example, pre-menopause, during their pregnancy, and after menopause, they have disease spectrum totally different from male gender. So we have collaboration with Taiwan Society of Perinatology and Taiwan Association of Obstetrics and Gynecology to talk about preeclampsia and gestational heart failure. And we have joint sessions, symposiums, and forums, invited well-known female cardiologists and gynecologists and obstetrician to talk about heart disease during their pregnancy. We have several new frontiers that were invited by different societies. For example, Dermatology Society, Taiwan Dermatological Association want to and invite TSOC to talk about psoriasis, which is a inflammatory disease, highly linked with autoimmune as well. And they have high correlation with cardiovascular disease. So we have a crosstalk whether we, when dermatology is facing psoriasis associated with cardiovascular disease, what should they do? We have several crosstalks. From the Taiwan College of Rheumatology, they want to talk about connective tissue disease and very hard to dealing with pulmonary hypertension. So we have crosstalk with Rheumatology Society, as well as Taiwan Society of Pulmonology and Critical Care Medicine and Taiwan Society of Sleep Medicine. They want to focus on obstructive sleep apnea. So they invite Taiwan Society of Cardiology to have expert crosstalks. And these important topics of psoriasis, connective tissue disease and pulmonary hypertension and obstructive sleep apnea, once we have a crosstalk, in the next step, we anticipated to have expert consensus to teach our members and their members as well, and to have scientific publication based on Taiwan's own experience and data to help these patients. This is the 2021 annual session. It's a virtual because of COVID-19. As you can see, the central control panel, just like a major league broadcasting room, we have altogether 8 streamlined simultaneously broadcast through air. Now, next topic I would like to talk about next generation cardiology training. Some of the countries, they have a postgraduate year 1 or year 2 training program and residency training of internal medicine, surgery, and pediatrician. But how about specialists? Once they went into specialist training, we used to, at least in Taiwan, we used to ask them how many echo they did, how many PCI they done, how many pacemaker they implanted, how many open heart surgery they did, in order to become an cardiology experts or specialist. We're thinking of whether to incorporate a new evaluation tool, namely entrustable professional activities, EPA, and milestones. Actually, these are not new evaluation training tools. This has been used in PGY training program and residency training program by the ACGME for years. And the EPA actually divided into 5 levels. Level 1 would be the trainee is able to observe, 2 to perform the activity under direct supervision, and 3 perform the activity under indirect supervision, and 4 perform the activity under distant supervision, and 5 actually the trainee will be able to supervise the young trainee in performing the activity. This is not a new idea. Actually, European Society of Cardiology bring up this core curriculum for the cardiologists and published in European Heart Journal in 2080. So in the future, we are hoping to evaluate your trainee based on knowledge, skills, attitude, put it all together as entrustable professional activities. Of course, there will be board examination in general cardiology, but at the same time, we also require multi-source feedback on these trainees. So we have recently finished our next generation cardiology training program based on EPA evaluation tool in the field of adult cardiology, cardiovascular surgery, and pediatric cardiology. We anticipate to submit this to the Ministry of Health and Welfare to the government for them to review our training program. There are a couple of upcoming projects from TSOC. One is the 2022 new hypertension guideline. The new feature will focus on home blood pressure measurement. This is actually try to empower blood pressure measurement involvement to our patients in an attempt to get a more precise, undisturbed blood pressure reading. And another second feature will be universal blood pressure treatment go down to 130 and 80. I believe most of the society, including ACC, they have this goal as well. This is based on recently published the SPRINT trial and the STEP trial. 130 and 80, we believe, can do most of the benefit to our patient, whether they are aged people or young generation hypertension or not. The second upcoming project will be TSOC new chronic syndrome guidelines. This is a strictly Taiwan-based risk prediction model, focusing on guideline-directed medical therapy and encompass prevention, diet, nutrition, smoking cessation, and so forth. Of course, there are unmet needs. If you look at cardiovascular disease burden in Asia, there are altogether 3 major spectrum of vascular disease: ischemic heart disease, stroke, and other cardiovascular disease. If you look at population, Asian versus global population will be 4.7 to 7.9 billions. So Asian population occupy more than 59%. This is data from 2021. If you look at GDP per capita data, Asian versus global would be 7,800 US dollars versus uh, uh, 115 US dollar, 100 US dollars. This is in 2021. But then again, the GDP growth in Asia is 5.7% and up. It's actually it is the fast growing economic continent among the world. But if you look at the disease spectrum from Asia, Central Asia, Western Asia, Southern Asia, and Eastern Asia, and Southeastern Asia, and so forth, ischemic heart disease and stroke dominate most of the cardiovascular disease. So these are unmet needs I want to raise up to most of our member society and nations in APSC. Actually, we lack of cross-nation society collaboration, lack of Asian-Pacific-based registry and clinical trials. Most of the pivotal landmark clinical trials, of course, they have Asian population, but only minority. And then, if we can achieve that, we can have a strong Asian-Pacific-based scientific data and publications. And we also need to implement artificial intelligence, big data, and precision medicine, and so forth. Once we achieve these hierarchical goals, like I mentioned before. Actually, Jack noticed that. ACC announced a plan for new ACC Asia as a scientific publication platform. And I learned that Asian Pacific Society of Cardiology has a plan for upcoming Journal of Asian Pacific Society of Cardiology. So in the future, we will have two very important journals and platforms for member society to send out good scientific paper to be published. Okay, will be my last slide. Taiwan Society of Cardiology is willing to have tight collaboration with all members of the APSC to join with you for future coming clinical trials as well as important registry. And I would like to pay special thanks to Japanese Circulatory Society, this host society of APSC 2022, and APSC organizing committee to let Taiwan Society of Cardiology to have this chance to share with you this Asian Pacific Leadership Series. Thank you very much.